Well, hello and welcome to this segment, Ethics of Artificial Intelligence, Balancing Innovation and Professional Responsibility in Addiction Counseling. In this segment, we will examine one of the most important issues facing those who provide services for individuals impacted by substance use disorders, that is, the ethical use of artificial intelligence in treating substance use disorders. Throughout this course, we have explored how AI can support screening, intake, assessment, treatment planning, counseling, case management, crisis intervention, client education, documentation, and consultation. While these technologies offer significant opportunities to improve efficiency and enhance clinical practice, they also introduce ethical challenges that require careful consideration. The question is no longer whether AI will influence treatment outcomes or treatment practices, but how clinicians can use these tools responsibly while protecting client welfare and maintaining professional integrity. Ethics has always served as the foundation of effective counseling practice. Professional codes of ethics, licensing regulations, and evidence based standards exist to protect clients and promote high quality care. As discussed in this chapter, ethical decision making in addiction counseling is guided by principles such as beneficence, non maleficence, autonomy, justice, fidelity, and respect for person. These principles remain equally important when technology becomes part of the clinical process. Regardless of how advanced AI systems become, ethical responsibilities cannot be delegated to software or automated systems. The clinician remains responsible for ensuring that all services are delivered in a manner that promotes client well-being and protect against harm. One of the most significant ethical concerns associated with AI is the potential for inaccurate or biased outputs. AI systems generate responses based on patterns found within large databases and may unintentionally reflect biases present in the information used to train them. These biases can influence recommendations, documentation, treatment suggestions, other clinical outputs. In some cases, AI generated information may appear accurate and authoritative while containing errors, omissions, or unsupported conclusions. For clinicians, this creates an ethical obligation to critically evaluate AI generated content rather than accepting it as face value. Artificial intelligence also raises important questions regarding transparency and explainability. In traditional clinical practice, counselors are expected to explain the rationale behind their decisions and interventions. However, some AI systems function as black boxes, generating recommendations without clearly explaining how those conclusions were reached. This lack of transparency can make it difficult for clinicians to evaluate the reliability of recommendations or explain decision making processes to clients and supervisors. Ethical practice requires that counselors understand the limitations of the tools they use and avoid over relying on recommendations they cannot adequately evaluate. Confidentiality and privacy represent additional ethical concerns. Addiction counselors routinely work with highly sensitive information protected by federal regulations, professional ethics, and privacy laws. Before incorporating AI into practice, clinicians must understand how information is collected, stored, processed, and protected. Protecting confidential information remains one of the most important responsibilities of every behavioral health professional. While AI offers significant opportunities, clinicians must remain aware of its limitations. While AI offers significant opportunities, clinicians must remain aware of its limitations. Technology can assist with information management, documentation, education, and clinical support, but it should not assume ethical responsibility. Ethical dilemmas often require consideration of context, values, competing interests, and potential consequences that extend beyond what technology can evaluate. As a result, human oversight remains essential whenever AI is used in clinical practice. Ethical AI use is not about choosing between technology and professional practice. It is about ensuring that innovation serves the best interests of the clients while preserving the values that define effective addiction counseling. AI can be a valuable tool when used thoughtfully, transparently, and responsibly. However, the responsibility for protecting clients, promoting fairness, maintaining confidentiality, and delivering ethical care will always remain with the clinician. As you complete this section, consider how ethical principles can guide the integration of AI into addiction counseling and how professional judgment remains essential in balancing technological innovation with client welfare.